Welcome everyone to the Shoyama Graduate School of Public Policy 6th Annual Houston Lecture. What has 30 years of research on the social determinants of health taught us about the housing and housing crisis? Featuring Dr. Patricia Ocampo, faculty member of the Dalla Lana School of Public Health with the University of Toronto. My name is Stephen Carey. I'm honored to be your MC for tonight's event. I'm a student with the Master of Health Administration program with the Shoyama Graduate School of Public Policy, as well as the manager of professional practice for the Pharmacy Association of Saskatchewan. I'm excited to be present for this evening's topic, as homelessness disproportionately affects racially and socially marginalized groups, and homelessness itself is a factor that drastically impacts healthcare. In my professional role, I'm well aware of how policies affecting drug and health coverage, as well as access, discriminate against people experiencing homelessness. I'm certain that Dr. Ocampo will be able to shed light on these such issues, as well as provide insight for everyone in attendance. I would like to acknowledge that while today's event is taking place on Treaty 6 territory in Saskatoon, as well as online, the JSGS physical homeland is located on Treaty 4 and Treaty 6 territories. The original lands of the Cree, Ojibwe, Saulteaux, Dakota, Lakota, Nakota, and the traditional homeland of the Métis-Michif Nation. We're glad to welcome you all joining us tonight from across Turtle Island and make this acknowledgement as an act of reconciliation and gratitude to those whose territory reside on or are visiting. I encourage you all to take a moment to reflect on the land you reside on and to express gratitude for the place and the people who have safeguarded it throughout time. I myself am a fourth-generation settler of German and French descent and owe a deep gratitude towards the people who safeguarded the land in Treaty 6 territory where my family has settled. I'll pause for a moment so we can all think about actions we can take to actively engage in reconciliation to honor the land and its people. Knowing that we have guests joining us from across the country, I would be remiss if I did not say a few brief remarks about our event host, the Shoyama Graduate School of Public Policy, or JSGS for short. JSGS is a national hub for advanced study and research in public policy and administration. With campuses at both the University of Saskatchewan and the University of Regina, the JSGS graduate and executive development programs build knowledge, skills, and competencies for success in government, nonprofits, cooperatives, and credit unions. Nationally recognized for its professional training and research excellence, JSGS is responding to the needs of public sector partners, including First Nations, Métis, and Inuit organizations, governments, and committees who are confronting economic, social, and environmental issues. One of JSGS research areas that speaks to me personally, and likely many of you joining us tonight, is the school's focus on social policy and inequality, and more specifically as it relates to health policy. Through events such as the Houston Lecture Series, JSGS is able to bring together thought leaders, academics, students, and community members to listen and learn about current issues affecting Canadians. Before I turn it over to JSGS's Executive Director, Dr. Lolene Berdahl, I would like to take care of a few housekeeping items that will help our event run smoothly. So for those of you in the room tonight, if you need to exit, there are exits on both sides of the room. We kindly ask that if you haven't already, please turn your cell phones to silent or turn them off. If you have questions later on in the evening for our speaker during the Q&A, you can make your way to the microphone just in the center of the room here, and you'll be called upon when it's time to pose your question. For those of you joining tonight via the live stream, if you have any questions for the speaker, please email it to jsgs.events@uregina.ca with the subject of Houston Lecture Question, and our moderator today will be able to pose the question on your behalf. If you have any logistical issues during today's presentation, please don't hesitate to send a message to that same email, jsgs.events@uregina.ca. So the format for our event tonight is as follows. Following our open remarks from Dr. Berdahl, our speaker, Dr. Patricia Ocampo, will present for 30 minutes. Following her presentation, Dr. Ocampo will engage in a fireside chat with Dr. Akram Mahani. after which we'll open it up for our audience Q&A. For those of you who are asking questions, please ensure that they're concise and to the point so that our speaker has the opportunity to respond to as many questions as possible. With that, I'd like to welcome to the stage Dr. Lolene Burdal to provide a few opening remarks.
Great. Well, thank you, Stephen. And on behalf of JSGS, it's my great pleasure to welcome and thank all of you for attending what promises to be an engaging and thought-provoking discussion. Today, we are very fortunate to have a number of individuals joining us both in person and online. But I want to take a minute to acknowledge and welcome Dr. Stan Houston and his wife, Venta Kabzems, pardon me if I mispronounced that, who are joining us in the room today, in addition to members of the Houston family who are joining this presentation online. The Houston Lecture Series would not be possible without the generosity and support of the late Dr. Stuart and Mary Houston and the Houston Family Trust. Both Stuart and Mary were greatly loved at the University of Saskatchewan for their genuine enthusiasm in supporting research and dialogue on campus. Widely known and respected for their love of ornithology, Stuart was also highly regarded for his distinguished medical career, specifically in diagnostic radiology. Interested in both medicine and Saskatchewan history, Stuart published extensively on the history of medicine and Saskatchewan's early achievements in healthcare. An early campaigner and defender of Medicare, Stuart developed an insight into the intersection of politics and health, the critical importance of the social determinants of health, and the vital need for public policies impacting health to be based on the best possible evidence. That's why he and Mary were so keen to support JSGS in facilitating dialogue and creating opportunities for evidence-based research in the areas of health, social justice, and income inequality in Canada. As part of their generous donation, the school launched the annual Houston Lecture Series in 2018 in their honor. Since then, we've welcomed a number of influential speakers to share their insight. For a period there, we went online due to COVID, and we are delighted to be back both in person and online and to welcome Dr. Patricia Ocampo to this growing list of incredibly distinguished Houston Lecture speakers. So with that, I'm going to turn the floor back over to Stephen to introduce our keynote speaker.
You'll just want to make sure those are all in order. Yeah. Perfect. Thank you so much, Lillian. Yeah. I now have the honor of introducing our 2024 Houston Lecture speaker. Dr. Patricia Ocampo is professor of public health and Canada Research Chair in Population Health Interventions Research. Dr. Ocampo's work focuses on upstream determinants of health and health equity, quantifying the impacts of structural issues and social programs, and working with affected communities to propose concrete solutions. She has worked over the past 2 decades to expand the knowledge base on community-based solutions to urban health inequities. She has served in executive academic research leadership roles for 2 decades and is currently the executive director of the Li Ka-shing Knowledge Institute with Unity Health at Toronto. She is a member of the Canadian Academy of Health Sciences and the Royal Society of Canada. I think we're in for an engaging discussion, and now I'd like to turn the floor over to Dr. Patricia Ocampo.
Thank you so much for the welcoming introduction. And I just want to say I am so pleased to be here in Saskatoon with you this evening to talk about these important issues. I think the pages are in order, so we're good to go. All right, so, there is a lot of talk about housing these days, whether it's affordable, whether the mortgage rates and the interest rates are going in the right direction, whether we have housing shortages and even homelessness, as was mentioned by Stephen. And these issues are often described in terms of being crises. And we have the data to back it up. So this survey that was released last year by Habitat for Humanity suggests that half of Canadians are spending at least half of their income on housing costs. And that's household income, not individual income. Also, 60% are worried that they're not going to be able to pay for essentials like food or clothing or education. 90% are concerned about the growing divide between those who can and cannot afford housing. To share a few other statistics, this shows data over time, starting in 1976. And there's two trends to pay attention to here. One is the trend in full-time incomes for individuals who are 25 to 34 years old. And that's the orange line that goes straight across. Adjusted for inflation, it suggests that full-time salaries for that age group have not really risen. But the blue line, which shows a disturbing trend, are housing prices, which have continued to go up steeply. An interesting feature of this, also disturbing though, are the bars and the numbers on top of the bars. If you pay attention to those numbers, which are around 5 in the 70s and 80s, that's the number of years that an individual would have to save in order to earn enough for a 20% down payment on their home. So it was around 5 in the 70s and 80s, and it's gone up to and exceeded 20 in recent years. So these challenges are definitely something that we have to pay attention to, and the trends that we've seen as of late are concerning. And what I want to talk today about, I want to talk about the match between the kind of evidence that we generate as researchers on the social determinants of health, especially housing as a determinant of health and health inequities, and whether that aligns with what is needed for creating strong programs and policies on housing. And you can tell by this picture that perhaps I'm going to conclude that there is a bit of a misalignment or a mismatch. So let's take a closer look at some of what we generate. So this is a framework that suggests that there are 4 key pillars of housing, and that's the shaded part in the middle here, that are related to both health and health inequities. They are housing affordability, the physical quality of housing, neighborhood factors, and also residential stability. And some of the boxes around it are the pathways on the right to affecting health or creating health inequities. And then on the left is the way in which structural features of society might affect those pillars. And this is a nice, comprehensive framework. That's the good news. The sad news is when we look at the research that's in the social determinants of health literature, it doesn't quite map on nicely across the whole framework here. In other words, there's some significant gaps, which means that we don't fully understand how these pillars are related to health or how they're generating health inequities. But there's a few more gaps around scope that we should probably mention. This framework isn't quite complete, and there are other factors that we should be paying attention to. And I've kind of listed them here. I won't read them because you can read them faster than I can read them to you. Some of them have to do with neighborhood factors like neighborhood cohesion. Another one is about psychological security. So there's a lot of attention to what the physical features are of houses, but there's not enough attention to what it means to have psychological security. So whether you feel proud of your home, whether you feel at home in your home. For example, women who are living with violence have a roof over their head and maybe stable housing, but they don't feel safe at home. So every day they don't have any psychological security. So some of these features in this green box also need to be examined. Not done yet, because there is one more complexity that we want to introduce, and that is there are different categories of housing. So if we look at this housing continuum, there's several categories of housing, and that means some of these pillars or some of the factors in the green box behave differently depending on whether you're talking about being a homeowner, being a market renter, or being in an emergency shelter, for example. So again, I'll just say that we don't have enough research to kind of cover all of these issues. So we have an incomplete understanding of the ways in which housing affects health at this point. So I want to dig a little bit deeper on one issue, because another way to look at the quality of research is to dig deeply on one issue to see how completely the literature can cover that issue. So let's talk about homelessness for a moment, since it seems like it's a big interest here, and I can see why, because there's talk about homelessness increasing, especially since the COVID-19 pandemic. And so we don't have great ways to exactly measure how big the homelessness problem is. And what we tend to use are point-in-time surveys. That is, we pick a day, and then we go to shelters, and we look on the street, and we see how many people we can count. And there have been some point-in-time surveys nationally, one in 2018, right before the pandemic, and then that's one that started during the pandemic, and it took a little longer to complete. So it spread out over a couple of years. But if you look at the difference in counts over time, it suggests that there's been a 20% increase since the pandemic started. And we're going in the wrong direction, because some countries are actually able to reduce, or maybe like Finland, even almost eliminate all of their homelessness problems. But we haven't been doing so well. Another thing that I want to point out is point-in-time estimates are really, in Canada, our best estimates of the size of the homelessness population. But what happens with point-in-time estimates is that we miss a significant portion of the population. So this is a great report to pay attention to if you haven't read it yet. Caitlin Schwan and her team generated this report based on the literature on the state of women's housing need and homelessness in Canada. I don't know about you, but when I see pictures of homelessness, they're usually of men. So we tend to think of homeless individuals as primarily being men. But women don't use those shelters, and women don't often sleep rough on the streets. And so we call women's homelessness more hidden homelessness, because they tend to couch surf or live at friends' or families' places for a while. They don't have a fixed address of their own. And so the size of the hidden homelessness population can be substantial. So this report tells us that in Finland, the size of the hidden population is 76%. And so if we exclude those individuals, we're really underestimating the size of the homeless population. In Ireland, it's 43% of the homeless population. We don't know what the size of the homeless population is in Canada, which is unfortunate. And it means, again, according to this report, that the full extent of homelessness among women, girls, and gender-diverse individuals in Canada is not known. But this means that governments are left to design and implement policies and programming in the absence of key knowledge data. So what are the implications of, I'll just say, ignoring this population? They're pretty significant. For example, we miss out on opportunities to design prevention interventions for homelessness that take into account the unique ways in which women and gender-diverse individuals enter into homelessness. So here we have two lists, and these are the top reasons that these groups enter into homelessness. And you can see there's not really overlap between the two. So if we're primarily designing homelessness prevention interventions based on men's circumstances, they're just not going to work for women. Now, when we take this approach where we're really, I'll just say, ignoring gender in our research or in our policies and programs, we're using what's called a gender insensitive or a gender blind approach. And it matters because it actually causes harm to the populations that are excluded. For example, here are the harms that result as a result of using a gender-blind approach to homelessness services. First of all, services tailored for men are often unsafe for women. There's many studies showing that those services, emergency shelters, temporary shelters for homeless individuals, are unsafe and irrelevant for women because women's needs and their priorities are neglected. So, for example, women would like to be able to take their children with them, but that's not allowed in some of the shelters. And you saw that women enter homelessness from a place of trauma, and a lot of those services are either not trauma-informed and not addressing the trauma that women are living with. Women's housing and homeless issues are not solved with gender-insensitive services. The attitudes and beliefs that are present in the shelter sector, et cetera, lead to a lot of victim blaming of women, gaslighting, and erasure of their experiences and needs. And then also women and gender diverse persons' homelessness issues are neglected in research as well. And that just feeds that cycle of disinformation about what it means to be homeless in Canada. So I talked about gender blind. I just want to share with you that gender blind is part of this continuum called gender transformation continuum, which is useful to know about because there are other approaches. We don't have to use a gender blind or a gender unequal approach. And so gender blind and gender unequal appear on this continuum over on the left. And if you use a gender unequal approach, it certainly perpetuates gender inequalities. Gender blind ignores gender inequalities and norms. As we move to the right, then we start using gender-aware approaches. So gender sensitivity acknowledges that there are differences. Ideally, we would use gender-transformative approaches all the way to the right that actually addresses the causes of gender-based social and health inequities and works to transform those harmful norms and relations that we're working with now when we're gender blind. So when we think about the kind of research we want to do, or maybe even the kind of policies and programs that we want to create, we want them to be over on the right. Gender aware, gender sensitive, maybe gender transformative. So let's do a little mapping exercise. I took some of the services that were relevant for women who were fleeing violence. Remember, that's one of the number one ways that women become homeless. So we have our continuum here at the top, and then I've mapped some services that are relevant for women who are fleeing violence. And what I had hoped to see was that they would be crowded over there on the right side of the continuum, but unfortunately they're not. The services are actually crowded on the left side here. Ooh, I do have a pointer. So for example, the gap in funding for the services that women are receiving to deal with domestic violence, there's a huge gap there. And so that creates a gender unequal situation, right? We have a lot of homelessness services for men because that's what the shelters and temporary shelters are for. They're really designed for men, but we don't have enough for women, and we don't have very many services for women fleeing violence. You may have heard that statistics that every day in Canada, we turn away 600 women from shelters who are trying to get in. That's every single day. So we have a severe shortage of funding for those kinds of services. Women experience, about 80% of women who are living with domestic violence experience some kind of economic abuse. So they end up with bad credit, bad loans, anyway, a bad economic situation. And financial institutions in Canada don't recognize that. Now, in other countries, they've recognized economic abuse, and financial institutions will work with them to clear their credit so they won't have a bad credit rating and that they can get loans if they need them and get help. But in Canada, they don't. And so again, we're putting them in this kind of gender blind, gender unequal category. So we need to do more education or something to kind of move some of these services over toward the gender transformative direction. Okay, so let's look at a policy or a strategy, a national strategy, the National Housing Strategy. I hope you've taken a look at the National Housing Strategy. We finally got a National Housing Strategy in Canada, one of the few countries that didn't have a National Housing Strategy until 2017. And there's a section in there where they talk about homelessness and making homelessness a history. That would be amazing if we could eliminate homelessness. And there is a section on there on veterans. So veterans do deserve some special attention. And I wanted to look at it to see is what kind of an approach that they're applying. Are they applying a gender-aware approach? And this is what I found. So the National Housing Strategy does call out male veterans as needing attention, and I wouldn't disagree with that. And also, when they talk about the kind of supports veteran needs, they call out trauma supports based on combat-related trauma. Okay, so if it actually were a gender transformative or gender aware approach, it would have these components there as well. There would be a recognition that women veterans are at high risk of homelessness. In fact, they're a fast-growing group among women who are homeless. It would also consider the unique needs of female active duty and veterans around trauma and the high proportion of lifetime trauma experienced by women veterans. Actually, the military is a place women go to escape a lot of their traumatic life circumstances. So they enter into the military with a history of trauma. So they would reduce military service-induced trauma, because that happens as well. And then they would create a safe space to disclose traumatic experiences, not only from combat, but from non-combat sources. And that would be for everybody as well, because men also entered the military with traumatic histories. And so if it were gender transformative, it would have those components, but it doesn't now. And so hopefully there will be some attention given to women veterans as well and meeting their needs. I will say that I'm talking a lot about policies, but the research on all of these issues is actually no different. It is not usually gender transformative. Okay, so let's take stock just a little bit about what's been said, because I've been talking about the scope of the social determinants of health research on housing for 30 years. And I think we can conclude that so far it's a little bit narrow. It's far too narrow. It doesn't really comprehensively address the key housing issues and how housing is related to health. In part, it's because we don't use the right theory and frameworks. And also, there are some who get it right, which is great, but they usually do it because they partner with those who are most affected. The health inequities that I described by gender also apply to other social locations. So, for example, by race, by disability status, by immigrant status. So we see inequities in housing that go beyond gender. And also, the frameworks fail to capture root causes and the pathways by which inequities are created. In fact, there was a study released this year in 2024, and it's from the US, where they did an analysis of 5 years of research of the biggest funders there who fund housing research, and they wanted to know what the gaps were. And that study concluded that one of the major gaps, even if they spend millions of dollars on housing research, is that the research fails to include information or ask questions about the causal pathways, the ways in which housing features are causally related to health, or the ways in which housing features are causing inequities. And so let's talk a little bit about that, because there are some frameworks that can help us with that as well. We just need to learn to use them more. I just want to share with you that often when we hear about the social determinants of health, and this is from the from the medical field, we often see a list of social determinants. So this is trying to tell us that the category of variables that are responsible for Canadians being sick or for well-being are primarily about your social determinants of health, right? They're housing and homelessness, community belonging, employment and working conditions, but they appear to us as a list. And so when you have a list, there's a lot missing there. For example, what's missing is we don't know what the root causes are. And we also don't know what systems of oppressions are there that kind of generate the inequities. So these key things, which will help us design better interventions, are missing from the way in which we often present the idea of the social determinants of health. And so I'd like to turn to a model called the coin model. Actually, it's a metaphor that says that we can represent systems of inequality with a coin. And the coin has two sides, so you've got to pay attention to that. You got the coin, two sides of the coin. The coin itself is the social structures that produce and maintain inequalities. So they could be things like sexism, racism, ableism, colonialism, capitalism. I think you can name some others. So that's the coin. And the coin, if you look at the bottom of the coin, that represents people who experience oppression. And the system of inequality gives people who are experiencing oppression disadvantages that they have and others don't. They didn't earn it. They have those disadvantages because of their social location. That's the way the system works. It gives them disadvantages because of who they are and their social location. So they have unearned disadvantage. It still doesn't quite tell us what the pathways are from that system of inequality to the inequities that we observe. So let's try and unpack this little red line here a little bit. And here I'm borrowing from the National Collaborating Center for the Determinants of Health, where they've kind of outlined the pathways from root causes to inequalities. So let's use the example of patriarchy, since we were talking about women and inequities a little while ago. So we start out with, patriarchal ideology, male domination, sexism, misogyny, and that informs a set of beliefs that we hold in society that are maintained by these oppressive power relations. They're negative, exaggerated beliefs, they're distorted ideas and about women, for example, and they're held by individuals, by groups, by decision makers, and those beliefs then inform attitudes, which is a way of thinking about gender stereotypes, for example, and roles and expectation. And those two are embedded, and they lead to discriminatory behaviors. So actions or inactions made possible explicitly or implicitly by oppressive gender power relations. That results in discrimination at the individual level, at the institutional level, in the workplace, in the housing sector, et cetera. And then we see those gender inequities that we've demonstrated and seen. So there's a couple of things to know about this pathway. One is that as we go to the right, we're able to see the discrimination. We're able to see the gender-based inequities. We can demonstrate those. We can measure those. But as we move up to upstream to the root causes, those are less visible. So we know right now, today, and yesterday, and probably tomorrow, patriarchy is operating. Yet, how often in your meetings do you talk about patriarchy? We don't talk about it very much. We don't see it on TV. We don't read about it that much in the media, even if it's operating every day. So we see the root causes less. We talk about the root causes less, even if they're the root causes and they're operating all the time. The other thing to remember about this pathway, and by the way, there are other pathways for other forms of oppression, is that these are caused by people, and we can disrupt where the arrows are. We can disrupt. Oops, There we go. We can disrupt this pathway here. We know that the gains that have been made by women and girls over the past several decades have resulted from shifts in attitudes. We used to think women would be terrible leaders. Now we know that women are as good a leader as men. We used to think that there were different abilities between girls and boys or men and women, but now we don't think that anymore. So it was the disruption in the thinking, in the beliefs, in the attitudes, and therefore less discrimination that changed things. And we can do that, right? Because it was created by people, so it can be undone or disrupted by people. Back to our coin. The coin has two sides, right? And the top of the coin represents individuals who, as a result of that system of inequality, they have power and privilege. So they have advantages that others don't. They didn't necessarily earn all of the power and privilege that they have. They got some of that power and privilege from that system of inequality, and they have it because of their social location. So they have unearned advantages. It's a system that works together. If there's oppression, there's going to be advantages given to another group. Now, there's not one coin, right? There's multiple coins. So here we have multiple coins representing, for example, racism, white supremacy, patriarchy, capitalism, ableism. We've already talked about some of these. So we have the privileged social locations at the top, and we have the oppressed social locations at the bottom. So there's a couple of things to know about this, in addition to there being more coins. In research, and I think in the media too, we tend to pay attention to those people who are oppressed. We talk a lot about how much they're spending on housing, or how much inequalities there are, or if you have more than one social location that's oppressed, you're going to have even more inequities, more disadvantage. And we rarely talk about the top of the coin and what's happening. But it's a system, and we should be talking about both. That is one of the big missing pieces of the discussion of inequities. And there's a reason for that, and I'm going to go into that in a moment. So we need to be talking about both sides of the coin. I think that's one take-home message. So back to the top of the coin, though. Groups with privileges are kind of kept invisible and missing from most explanatory frameworks. They're not named as part of the process of conferring oppression or gaining privilege. And they actually work to maintain that privilege. Actually, the system uses them to reinforce this whole system to maintain the status quo of inequities. How many decades have we been talking about inequities? And when we do, we usually talk about the bottom of the coin. We don't talk that much about the top because the people with power and privilege, or the system enables the people with power and privilege to kind of cloak those power and privileges. That way they can look like they're not really involved. The problem is over there with the oppressed people. I don't have a role here, and that's not true. Anyone who has a privileged role, I have several on the graph that I showed you just a minute ago. We have a role to use that privilege to disrupt this system here. But if we don't see ourselves, if no one calls us out, and if no one says, hey, you have a role here because you're part of this system, then we're not going to use that power and privilege to act. Okay, so what kind of cloaking? There's this huge list. I'm just going to name a few of them. One of them is blame the victim. So if somebody says, oh, these inequalities are awful, whatever, well, we immediately run to blame the victim, right? Another one are these moves to innocence. People with power and privilege minimize the role of male privilege. So I've been in a number of meetings, leadership meetings. They're like, what are we going to do with these, gender inequities? Men get more grants than women. Men get more promotion than women. And there's always this, well, women have to speak out more. Women have to try harder. Women have to do this. There's always that. And if somebody says, well, maybe we have to, worry about male privilege. I remember being in one meeting where the facilitator, who was a male, said, what? Like, he pretended not to know, or maybe he really didn't know what male privilege was. And he kept forgetting about it in the meeting as we went on. So that's kind of a moves to innocence, right? Not recognizing that male privilege exists. Gaslighting, so using some stereotypes that we have of women to cause harm. So there are times when women call the police when they're experiencing domestic violence, and their partner's there. When the police arrive, the police tries to figure out what's going on, and the perpetrator might say, well, she's crazy, she exaggerates, she this. So using the stereotypes against women, a form of gaslighting. And again, there's more strategies that are used, and it's a way of kind of cloaking people who are at the top of the coin and the benefits that they are receiving. Okay, so all of these inequities happen in the housing sector as well, but we do a similar thing when it comes to housing inequities. I've just illustrated here, renters and landlords. We talk a lot about, what is the plight of the renter? They're paying so much money, they're getting evicted, so we talk about their oppression, but we don't talk enough about the landlords. And we don't talk about the benefits that they get being a landlord. In fact, when you look in the media, it looks a little bit like, they're struggling too. But in fact, that's not the case. They're actually gaining quite a bit of wealth being a landlord, at least in Canada. So one example of that is the difference between how much incomes have risen in Canada among renters versus how much rent has increased over the period of 2006 to 2019. So over that period, if we compare how much has rent increased compared to income, rent increased 13 times more in Hamilton than income did. In Saskatoon and in Victoria, it's about 5 times more. So rent is rising. Landlords are making more money being landlords than renters are able to receive in their increases due to cost of living or raises. Another thing that we don't really discuss is the increased financialization of housing in Canada. And, that's really buying properties so that as investments. So really we're trying to make money, or not we, I don't buy properties, but those who do financialization are using properties as a way to make money. What they care about more is making sure that they satisfy their shareholders and that they make money, because this is a way to make money. They're not about building a better community and keeping track of how much renters are struggling. And there was a report issued by the Federal Housing Advocate in 2022 about this whole issue of financialization, yet another report that is worth looking at. And the conclusion was, or a conclusion was, that financialization is a driver of social inequity now in Canada. And there were a number of harms that were documented as a consequence of financialization on affordability, on harassment. So a lot of renters are harassed. They're charged illegal fees. They are displaced. They are evicted. And there are well-documented unequal impacts by various subpopulations in terms of the impact of financialization. So the other thing to know, though, is that these relationships are not static. They're not given. You don't just get an assignment, okay, I have a privilege or I have a disadvantage. There are ways to disrupt or to maybe shift the power balance between those who are oppressed and those who hold power. And there's a number of activities that are done in the housing sector, for example, by advocacy groups, that have been successful. It's slow going. They have to address one issue at a time. Nevertheless, they exist and have success in trying to shift the power imbalance. And we don't study that activity enough either. So that's something that we need to do. Okay, so we're finally at the end here, and I want to summarize some of the key messages. And the first has been that, over the last 30 years of the social determinants of health research, researchers have only been partially successful to generate the necessary evidence to understand fully the social determinants of health and the way in which housing impacts health and generates health inequities, and partially successful in generating evidence to close those inequity gaps. So we really need to do better going forward. We need to learn from what we didn't do well, and going forward, we need to use accurate frameworks that allow us to be more comprehensive, to capture the ways in which inequities are generated, and capture the top of the coin, so who's benefiting from all of this inequity. You know, as researchers, we have a little bit of a superpower here. We've got academic freedom. We are talking about power relations here, so we can use our academic freedom to be more vocal about the need to change some of these power dynamics that are contributing to and causing and driving the inequities and these crises in the housing sector. And we need to work more closely with individuals and groups with lived experience. I haven't said that enough, but I need you to know that is definitely a given. Okay, you're not off the hook here because we all need to take some action. We all have a role to play in disrupting some of those power relations and the oppression that's happening. When we think about change, we often think about, we need to innovate, we need to have tons of money for these new initiatives, but change is also about disruption. We are causing these inequities now, so we need to stop doing a lot of things that we're doing now, and that doesn't cost any money for us to stop doing what we're doing. So we need to also think about disruption when we think about change, and not just new initiatives. So bring in the experience of those with lived expertise. And I guess as you think about taking action and moving forward, I hope you can approach all those actions with optimism, because I think most Canadians really share a vision for a more equitable Canada. So we can work together to do this. Thank you.
Thank you very much, Dr. Ocampo. Oh, yeah, absolutely. I'd like to now welcome Dr. Mahani to join Dr. Ocampo for our fireside chat, after which we'll have our Q&A. And just as a reminder for those joining via our live feed, you can submit questions for the Q&A at jsgs.events@uregina.ca.
Can you hear me? Okay, great. Thank you so much, Dr. Ocampo, for this very thoughtful presentation, very powerful presentation, and sharing your helpful and thoughtful insight with us today. And thank you so much for joining us today, and those who are joining us live. Just a reminder, as Stephen mentioned, that if you have a question from Dr. Ocampo, just come to the mic when it's time for question, and those live, submit your question through the email jsgs.events@uregina.ca, and with the subject line of Houston lecture question. And so as to get ready with some question, I do have a few that I can start. So you mentioned beautifully, the research over the past 3 decades on social determinants of health, and I wonder why you mentioned actually in the final slides that what we need to do more and what are the gaps. So I wonder why the research in this field has been slow to acknowledge the key drivers for health inequities.
Can you hear me? Yeah, okay. Okay, thank you for that question. I think there's a couple of key reasons, and I'll try and hit on the highlights. One is that we're really talking about health research, and so much of health research kind of relies on a biomedical model, not really a social model, and I think that's why we've missed out on some of these frameworks, the gender transformative framework and some of the social frameworks that talk about how inequities are generated. So we need to bring more social theory into our health research. That's one. Another one is, you know, a lot of research is copying others. And so if we're copying others who don't use these frameworks, then we're sort of maintaining the status quo. There are also the kind of cloaking strategies that I mentioned, where we don't focus enough on those who have power and privilege, or we don't focus enough on how that the system of inequality confers advantages, and what the role of those with power and privilege are. So I think that's really a missing piece of the social determinants of health literature that has really created this sort of slowness to adapt the right frameworks.
Oh, thank you so much. You also, you know, you just beautifully mentioned the frameworks that, you know, like gender inequality and all these frameworks. And I wonder why, you know, what we can learn from these frameworks, you know, these approaches and these frameworks to help us better, you know, understand the housing crisis that we are facing now. Yeah. How can we use these frameworks to better understand, to solve?
Yeah. Well, I think the frameworks help us to understand that there are populations with unique needs, and that we can't always rely on the dominant population and the evidence around the dominant population and apply it to these other populations. I mean, we tried to do that in health research when women were excluded from clinical trials, right? And we were coming up with the wrong answers for women. And so we need to stop using that pattern and recognize that different populations have unique needs. And then we need to devote the money to study those populations, to come up with the evidence to inform the kinds of interventions that they need. But I also think working more closely with affected populations will help us realize that faster.
This is my question, actually. That you just address it, and you also in your final slide around when we talked about, you know, recommendations and taking action. One of your recommendation was we need to engage affected communities. We need to engage persons with lived experience. And I wonder, what are your thoughts on how, as a researcher, I'm doing research, so how we can more meaningfully engage persons with lived experience, you know, in our work, and what are the tools we can use to better, you know, engage affected communities and a person with lived experience?
Yeah, thank you for that question, because I didn't really have a chance to emphasize that point enough in my presentation. But I do think it is an important strategy that we should always be using, frankly, especially when we're talking about issues of inequities. Everyone should have a voice at the research table to talk about what their experiences are. I will say that either when someone's starting out, or one of the patterns that I've seen that's a little bit concerning is that often researchers will just take volunteers to be part of their research, and they don't really consider equity, or they don't train their research teams to support individuals to come onto a research, to support community members, people who are not trained in research, to come on to their research teams. And so individuals who are experiencing multiple marginalizations may not feel comfortable or safe at the table. And so it really creates preparation on the part of the researcher to prepare themselves and to prepare their teams so that they can work with individuals who don't have research training, and that they can also create a situation where they can be inclusive about research, about members who might come onto their team who don't have research training. You know, there's some tools out there, but they don't really talk about an inclusive approach. They just talk about bringing people on. So I think we have to be cautious about ensuring that we're inclusive, and that when we think about wanting to bring community members onto our research teams, that we start with ourselves as researchers, and we work on ourselves to be ready to bring someone on, then we work on our teams, and then we bring someone on. So we shouldn't just rush to bring on a volunteer, for example.
Wow, thank you so much. That was absolutely learning for me. Yeah, thank you. So I guess we can move to a question from the audience here, and also I received some question in my inbox. So let's start with one question that came from the registration form. Let's start with that one, and then we go to alternate between room and live. So we received a couple of questions regarding indigenous communities. And one of the questions was the prevalence of poverty and mental health rates for indigenous youth and adults has been significantly high for decades and generations for both on reserve and urban areas, even longer for unreserved population. And there is a deeply rooted history to this, riddled with systemic barriers such as colonial-based policies and legislation that is not reflective of indigenous values, with bureaucracy compounding the situation, which produces even more barriers. And the question is, how do you address this when you, in your conversation with your colleagues, how you address this, and what is your suggestion or advice for policymakers? Is it clear?
Sure. Okay, I'm going to try that. Yeah.
Quite
Complicated
long.
question. So yes, I would agree that, you know, in the framework that I presented, we talked about the ways in which inequalities are created. And they're based on systems of oppression, and certainly colonialism is one of those. When we saw maybe I'll just, you know, bring up one of my slides. Almost there. There, okay. So, you know, we talk about systems of inequalities here, and too many papers, okay. And so here, you know, we have the colonialism here, where we've got indigenous populations at the bottom who are experiencing oppression, as you mentioned, decades of it. And then we've got settlers who are experiencing, as a consequence of this system of inequality, privileges and power. And this relationship started hundreds of years ago and is still going on now. We still have colonialism happening now, and it's still going on. And so, you know, what we need to do is we need to disrupt that. And you mentioned that there are, I think, bureaucracies or bureaucrats who are sort of acting as barriers. To be honest, that's another one of those, you know, cloaking mechanisms. It can be everything from, like, one of them is structured kind of incompetence. You just aren't making progress in fixing the problem. And, you know, you say, yes, okay, we'll get to it, but then you don't. So either structured inattention or just being incompetent about fixing the problem, that's one of the strategies that's used to maintain the status quo. And so we can recognize those and we can call it out. There's no reason to delay action. You know, one of the things that happens that I'm noticing around the issue of race, for example, in health, I promise I'll get back to the indigenous issue, but there's a lot of calls for fixing racial inequalities by getting more data on race, for example. And I'm not going to say that's not important, but I worry that that's a form of structured inattention. What I mean by that is, because we don't routinely collect race data here, in order for us to get enough people with race data attached to their health records or whatever, it's going to take us how long? Not a month, not a year, probably many years to collect the data, to make sure it's accurate, to check it, then to be able to do the analyses, right? So we're talking about losing 5 years, let's just say, optimistically, before we can then take action. And even if we demonstrate, by the way, we know right now those racial inequalities exist. I don't think anybody here is going to disagree with me. So do we need to know if the magnitude is 32% or 35%? We know they exist. So why not bypass the 5 years of delayed action and start to take action now. And the same thing happens here. Do we really need to study the problem so we know every parameter, or can we just begin to work on solutions now? So we need to be careful about recommending, let's collect a lot of data, let's do more research. And I'm saying this as a researcher. We don't want to use more research or needing more research as an excuse for not taking action. So I guess that's what I would say to my colleagues.
Thank you so much. I think we can go to one of the audience here. If you have if you go to the microphone, please.
Hi. I have a lot of interest in the social determinants of health. And my role is suicide prevention coordinator. And I think the social determinants of health and housing included are driving the suicide rates in our province, which are continuing to go up despite a lot of people doing work. Can you speak to how housing might be driving suicide rates? Some of the data I've seen show that in the month leading up to homelessness, the risk of suicide goes up 5-fold. So have you seen any of that in any of your studies, any of the literature you've reviewed?
Thank you for bringing that to my attention. I have to admit that I have not, I've studied mental health and mental distress, but not suicide. I know that's a special case of mental distress. And, there are triggers, and I'm not an expert. So, and I hadn't heard that statistic about risk of homelessness contributing to suicide risk. So clearly we need more information on that, and even how we can, in the homelessness service sector, be aware of those issues and aware of the risk of suicide, and how we can address it, ideally in a preventative fashion, but also even if somebody does become homeless, that we're aware of some of the suicide issues. So thank you for bringing that to my attention.
Thank you, Dr. Akram, for this response. I see a lot of questions coming around homelessness, and I'm going to read one of them. The question is there evidence to suggest that there is a dynamic between race and gender in homelessness in Canadian society? And the question is from Aisha Shahbaz. She says, so are non-white women, broadly speaking as an example, perhaps more prone to experience homelessness? And if so, what can be done in the policy space to address this?
So I would say that we have more data on men than we do women, for the reasons that I mentioned in the presentation. But I do know that there are many racialized individuals who are experiencing homelessness. And it does vary by city. So I say that because I was part of a study where there were 5 sites across Canada, and the populations that were homeless in those cities differed by a lot. In Toronto, they were primarily racialized, for example, but in Winnipeg, they were primarily Indigenous. So it's going to vary depending on where you are geographically. I do think, and we don't know enough about women because it's the hidden homelessness population. So I think we need to get a handle on the full population of homeless in Canada, and we don't have that now. And then I would love to take a gender transformative approach to it, so that we don't favor one gender or the other, and we don't neglect any of the genders either.
Thank you so much. I think we can go to one question in the room.
Hi, Pat. I'm wondering if you can speak to the role of governance in the social determinants of health. And I'm thinking, Saskatchewan has a long tradition of kind of emergent solutions to social problems. The Saskatoon Community Clinic, pioneer in interdisciplinary team-based care.
Yeah.
We have a mental health co-op here that was started by patients from clinics. We have a youth co-op for people who've been in and around the criminal justice system. And what they do is they empower people, not just relying on outside researchers to tell them what's wrong or what's not wrong, but they lift them up and create structures. So can you speak to that? Have you seen anything in the literature? Housing co-ops would be another example. Can you speak to that and discuss what you've seen in the literature? Thank you.
Yeah, I really love what you're saying, that people are able to come up with solutions that work for them. I think that's really important. I think governments don't pay enough attention to affected communities. I know they do consultations, but that's not really tapping into the needs and the possible solutions coming from those populations. So I love it when something can be grassroots. I don't see governments really supporting that approach very much, at least not in Ontario. So when that's possible, I think it's great. And, I think that governments are influenced by those with power and privilege a little bit too much, so that the solutions that come out around housing are really in support of landlord interests more than they are renter interests. So having the opportunity to have some of the grassroots strategies, I think that's great. And that is aligned with centering the needs of those who are most affected and letting them have a say in what the solutions are. I think that's great. Another thing to say, though, is I mentioned that Finland has been able to really eliminate a lot of their homelessness problem. And they've done it by using that housing first approach. So if somebody is homeless, you house them in an apartment with supports as needed. I noticed that some of the countries that are in the EU sort of have an accountability to the EU. They have an external accountability. They have to generate reports and they have to turn them into the EU, and they're public. And they have to talk about what strategies they're using. Our governments are not accountable to anybody outside, or we don't see who they're accountable to, right? So that might be something to consider, is thinking about the accountability of governments. So that they can, so in the EU, they're talking about inequities, talking about discrimination, and what strategies they're using to eliminate and reduce discrimination, for example. And they're monitored, and they're evaluated, and they're given feedback, and they're expected to perform. So that's something that I think the populations benefit from that we actually don't have here in this country.
Oh, thank you so much. That was so interesting to learn, that we lack this sort of global governance, at least for the North American countries too, right? For accountability. Yeah, thank you. We have a question here. You mentioned that in your recommendations, and also the question I had around how to meaningfully engage a person with lived experience and affected communities. And so the question here is around, given the role of research in transforming the homelessness crisis in Canada, do you feel that the Research Ethics Committee have a role to play in enhancing research on homelessness, especially if you want to engage people with lived experience? So given that, the ethics has some very tough rules in terms of vulnerable populations. So the question is, the issue is that gaining ethical approval to conduct research with vulnerable population is tough, and this might influence the kind of research on the topic.
Yeah. My experiences at Research Ethics Board really vary in terms of how they approach these particular issues. So I'm not sure that there's like a one-size-fits-all Research Ethics Board, and I'm not sure I have a very good answer. But I think that, one thing we could do is to bring more individuals who are affected onto Research Ethics Boards, so that I think Research Ethics Boards can learn. I don't know if because I'm part of a hospital Research Ethics Board, and most of what they look at is about clinical trials and medical interventions and things like that. But some of the projects that we submit, the Research Ethics Board has trouble kind of figuring out what the primary ethical issues are. But maybe if they were to bring on, just like researchers should bring on individuals with who are affected with lived expertise, maybe research ethics boards could do that too.
Thank you so much. I think we can go back to the room. Yeah.
Thank you. So my question is about substance use. We are in the midst of a devastating toxic drug and overdose crisis, yet we regularly see policies that require people be sober in order to get shelter housing or engage in supportive housing programs. So do you have suggestions for how to address this type of thinking and these barriers for our community members? Thank you.
Well, if we could eliminate homelessness, we don't have to worry about the shelters. If we could use a housing first approach so that people could be in their own homes, I think that would be helpful. But yes, I hear what you're saying about some of the strict criteria for people entering shelters, and I think it causes harm. I think, we have to figure out a better way to serve all of our populations and not just a subset of the population. But that's kind of what's happening now. Some of it is because of capacity. We don't have different shelters to meet everyone's needs. But I think we should try harder to really solve the homelessness problem and eliminate homelessness rather than trying to make more shelters and better shelters would be something that I would like to see happen.
Thank you so much. So we have another question here, which is around the framework you mentioned. You talked about the frameworks and the theories. There is one question coming from the Ministry of Social Services, and they ask, what are some of the neglected social theories to homelessness?
Well, as I mentioned before, because we tend to think of homeless individuals as being primarily men, we understand more their pathways to entering homelessness. And so some of the theories that we need to look at are the ways in which women are entering homelessness. So that has to do with violence, that has to do with trauma, and we need to understand the ways in which women's needs and issues in general, in many different sectors in society, are not considered or prioritized or recognized. So that's something that we need to bring in more, is understanding that from a theoretical perspective.
Thank you so much. So I guess we go for, one question in the room.
First of all, thanks for an incredible presentation. I think my question relates a little bit more about how to link evidence-based research with policy decision-making. I feel that there is a disconnect there's a lot of great effort making, high-quality research, evidence-based research, inclusive research, and then somewhere the link is lost, and that information, that vast amount of information we're producing doesn't get in the hands of decision makers, boards of trustees, chiefs of police, chiefs of fire, CEOs of hospitals. So how do we bridge the gap between what academia is doing and what decision makers need, especially given the housing crisis?
Thank you for that question. I don't think we know the right answer, and there's not just one way. There are some researchers try and work closely with decision makers, let them in on what they're doing, make them aware from the beginning about what they're doing, so that policymakers might anticipate the findings of this evidence-based research. There's a lot of theories about how policies are made, and evidence sometimes figures in there and sometimes it doesn't. It's about political will. It's about what influences a particular decision maker as well. I recognize that evidence doesn't always play a role. You know, in an ideal world it would, but we have to keep in mind that there are a lot of factors that go into the decision about what action a policymaker is going to take and whether they're going to act on the evidence that is presented to them or not. So I don't really have a good answer for you. I know that people have been trying to study it. I know it's not great evidence equals the right policy. Unfortunately, it's not that simple.
Thank you so much. There is a question that we actually it came through the registration form, and I see this coming here as well, which is around tiny home zoning and regulation. And the question is, do you have any research or current knowledge as to why mobile tiny homes are not being seriously considered as options? And do you think that the fact that they cannot be charged property taxes under current regulation is one of the reasons they aren't being considered? And do you feel tiny homes would be one good solution for those who choose minimalist living? And if so, why?
Yeah, I don't know a lot about tiny homes. I think tiny homes aren't necessarily going to solve our housing crisis. And certainly, you know, if people want minimalist living, I think they should have the choice to be able to do that. But I don't know why they're not supported. I don't know if it's about the tax issue that was mentioned. So I guess I don't know enough about tiny homes. Maybe somebody here knows about tiny homes and can actually answer that question. But I don't have enough information.
Thank you. So I think we have time to go to one more question in the room. And no question in the room? Okay. I have one question from the registration form. I'm gonna read that one. So you talked about financialization, and you pointed to the report that was, I think it was quite recent, right?
2022, yes.
Yeah. And I think this question is quite aligned with that. Can you talk more about ways that commodifying housing plays a role in unaffordable housing? And what factors beyond the availability of sufficient housing play the biggest role in determining affordability?
Well, yes, I think the issue of financialization, that is using, you know, rentals as a form of investment where you expect to get a return, and a return for, you know, by charging rent, and then for investors. I believe that there are calls, I should say, and read the report, it's excellent. There are calls for better regulations around that. There are some jurisdictions, for example, that limit the number of homes that you can have as an investment. Otherwise, big firms that buy a lot of homes can just buy more, and then you'll have a lot of financialization, and then you'll have very big, powerful landlords. You saw that there are quite a few negative impacts of financialization from the report, and they go into better detail in that report than I was able to in my short presentation. And so there aren't a lot of positive impacts that have been mentioned as a result of financialization, other than to the investors and to the landlords for the profits that they're able to generate. Yeah, I do think, and the report concluded that it is contributing to the affordability crisis that we're experiencing in the rental market. In terms of what other issues are really driving things, you know, I think that, and again, maybe each city, each jurisdiction is going to have a slightly different experience, because municipalities come up with different And so it's kind of hard to generalize like what the biggest factor is. But I do think that there's a lot of influence on governments to really side with landlords and developers more so than renters. And that's why we're having some of the affordability crises that we're having now. And that's why rents can rise far faster than income, for example, creating that mismatch between income and rents.
Thank you so much. We have one. Do we have any question in the room? No? Okay.
So I just want to ask about young people, the younger generations, and what have you maybe seen in your research about how younger people are affected by housing precarity, by being structurally disadvantaged and disenfranchised out of the housing market? I don't see myself in any of those bottom tiers of disadvantage, but as a young person, it's certainly not easy.
Yeah.
I've experienced housing precarity, and maybe speak to maybe what the research has shown about how young people are affected by that precarity.
Yeah, thank you. One of the graphs that I showed early on was in fact focused on young people. And let's see if, I should be doing it this way, I think. There we go. It's going to be better. And there is research on younger people. Okay, we're almost there. There. There is research. There is concern about the next generation of homeowners. Are people gonna, own homes? Young people, are they gonna be able to afford it? And you can see here that what this is suggesting, that people on an average salary from 25 to 34 years old, it's gonna take them 22 years to be able to save up for the 20% of the down payment. So they're not going to be able to own a home anytime soon. And if that trend continues, it's just going to get worse. And there's other research focusing on that age group because, again, that's the next generation of homeowners and how they're struggling and how they don't see themselves as homeowners for these reasons because the housing prices and the down payments seem really unattainable. And there's also a lot of evidence about the younger generation living at home longer, right? They're having to live at home with their parents because they can't afford even to rent on the salaries that they have while they're still young. So it's a real concern. People are researching it, and they're probably experiencing more of this housing crisis than some of the other age groups that are still trying to deal with housing, but they have either higher salaries than young people, or they might have some more resources to mobilize toward buying a house if that's what they want to do. But I would agree with you. I think it's a real concern.
Okay, thank you so much. I think we are at the time to finish Q&A, and I see a couple of a couple of questions left. Thank you so much to the audience in the room and those live for your questions, and thank you, Dr. Ocampo, for your thoughtful answers. I will turn the floor back to Stephen. Thank you.
Yes, thanks very much, Dr. Mahani, for facilitating the discussion and the Q&A, and thank you, Dr. Ocampo, for your insight. I think one of the big things that stood out, and it was funny because you said at your end of your presentation you hadn't mentioned the community engagement piece that much, but it was a big standout and it definitely came through in the Q&A. And I think, I'm paraphrasing, but you had said that people come up with the solutions that work for them. So it's not just engaging with them, but it's allowing them to create the solutions and allowing them to take the leadership in those solutions. So thank you for that. Before I conclude the 6th annual Houston Lecture, I'm pleased to remind you that this lecture will be recorded and posted to the JSGS website after it's been edited. For more information on upcoming JSGS lectures or to learn more about the academic programs, the executive education training, and public lectures, visit us online at www.schoolofpublicpolicy.sk.ca. If you enjoyed this particular presentation, I encourage you as well to join on Friday for a discussion on housing, homelessness, and human rights, a discussion about law and policy. Details on that lecture can be found on the JSGS calendar events, or the events calendar on the website. So once again, thank you to tonight's speakers, Dr. Patricia Ocampo, Dr. Akram Mahani, and Dr. Loline Berdal. Very much appreciate it. We'd also like to say a quick thank you to our members of our JSGS Houston Lecture Committee, made up of Dr. Cheryl Camillo as well as Dr. Akram Mahani, who work each year to select speakers and topics for the series. Thank you as well to the Houston family for making this event possible. Last but not least, thank you everyone who joined us in person tonight, as well as those who joined us online. We hope you found this conversation and presentation interesting and relevant to what your areas of research, what your areas of policy, or your work are. Thank you again, everyone, and have a wonderful evening.